As president of the European Restless Legs Syndrome Study Group, I'm very proud to present this timely initiative to raise awareness about this very burdensome disease, bringing together European sleep specialists and collaborating with EURLS, a European non-profit alliance of national patients' organizations. Our study group fosters research on RLS to favor early diagnosis and improve management, with the aim of ameliorating patients' life quality and prognosis.
Restless leg syndrome is a common neurological disorder characterized by an irresistible urge to move the legs, accompanied or caused by unpleasant sensation, which begin or worsen during inactivity and during rest, and in the evening or at night, with a partial or total relief by movement.
Patients with RLS are going through various medical instances before being diagnosed and finding help. Awareness of such a widespread disease among doctors and the public is of high value.
RLS patients have difficulties describing their symptoms despite a significant level of vexation. I tell medicine students that if the patient has problems expressing an unpleasant feeling in the legs, they should consider RLS.
Symptoms of restless leg vary considerably in age at onset, frequency and severity. Restless leg may occur alone or with comorbidities such as iron deficiency, kidney disease, cardiovascular disorder, diabetes, neurological disorder. Clearly, nowadays, restless leg management should be personalized, taking into account comorbidity and their medication.
1 to 2% of the general population has severe RLS, with impact on quality of sleep, daytime performance, social engagement, psychological health, and general quality of life.
RLS occurs frequently during the last 2 trimesters of pregnancy with a negative impact on the quality of sleep. RLS should be differentiated from other symptoms occurring in pregnancy like leg edema, leg discomfort, positional discomfort. Patients and gynecologists should be aware of RLS since only a correct diagnosis can lead to specific therapy.
Have you ever tried to scratch your back, but you are unable to reach this itchy point? Have you ever felt squeezed in a bus or a plane and you can do nothing about it? Have you ever tried to thread a needle and you are unsuccessful and you feel hopeless and useless? This is how an RLS patient feels.
Well, as you know, dopaminergic treatments, despite their well-known short-term efficacy, cause in most cases over the long term a worsening of RLS symptoms. And this iatrogenic, that means drug-induced worsening of the RLS symptoms, is what we call the dopaminergic augmentation. Gabapentin and pregabalin, but also opioids, are effective drugs and do not cause over the long-term augmentation. But indeed, we are currently investigating new treatments that might be also lacking augmentation over the long term. Particularly promising are those that reduce brain glutamate or do increase adenosine, brain adenosine. New research is also shedding light on the role of hypocretins in RLS.
Effective treatment for RLS can greatly enhance an individual's quality of life by alleviating the distressing symptoms, promoting better sleep, and enabling engagement in daily activities with increased energy and comfort. Expert doctors' advice is essential for RLS patients in order to improve management and navigate the range of treatments available.
RLS patients need better and personalized treatment, faster diagnosis, and ideally preventive measures so that they do not become patients in the first place. We can only achieve these goals with intensive basic and translational research.
There is no cure for restless legs. Treatment options are limited. First-line medications don't work for some patients, and over time actually make the disease worse for many other patients due to augmentation. All this means that the patient community are anxiously waiting for new treatment, for new medicines. In addition to that, finding a doctor with sufficient knowledge of RLS and RLS treatment throughout Europe is a major problem. And that means that education about restless legs to the healthcare professionals is equally urgently needed.
There are almost 75,000 patients with RLS only in Europe. Help us raising awareness on this condition, sharing this video, and visit the website EURLSSG.com for more information and to provide your support to RLS research. Help us helping patients with RLS. Thank you.